Peace and greetings to you. This is Omar Abdul Malik, physician assistant and health educator. I wanted to talk to you all tonight about the concept of autonomy in medicine. Now, as you all know, that I'm a physician assistant, and there's been some changes in the physician assistant profession that actually give us some increased autonomy. And this is still contingent upon state. I think this is a one of the differences that's often touted between nurse practitioners and PAs. One of my colleagues, I had interviewed Mr. Ghani, who's a nurse practitioner, was telling me how he has total autonomy, which is there's pros and cons to that. As a PA, I've been able to function with mostly, I'd say about 95% autonomy throughout the duration of my 16-year career. What I have noticed is that there seems to be a decreasing amount of autonomy among medical doctors, and this is what they've told me. And these are well-established physicians. That one doctor who had been practicing for 40 years said, "Look, gone are the days where a doctor could do whatever he or she wanted. There was a day you could practice medicine with however you wanted, but now there's a lot of regulations on it. There's a lot of bureaucracy. Physicians are often beholden to insurance companies that'll say, well, look, you can write for that prescription if you want, or you can do that procedure on that patient if you want to, but we're not going to pay for it." Then, even if you're going to do something like surgery, if a particular hospital says, well, look, we consider this particular surgery too high risk, so we don't want you doing it. What is the doctor going to do? Do the surgery anyway? And you can't do a surgery by yourself anyway without an anesthesiologist there, or a CRN A, or a surgical technician. So even if you become a surgeon, you can't do it by yourself. One surgeon told me that he felt, in a sense, even surgeons like himself had become little more than highly paid technicians, and I thought that was kind of interesting. It's kind of the way everything's going now, because everything has become such a business. Medicine starts from the academic uh, base. So college tuitions have skyrocketed. So even for physician assistants like myself, you got to get a bachelor's degree. That's going to cost you tens of thousands of dollars. Then a master's degree, another tens of thousands of dollars. So you got people coming out $100,000 in debt as a physician assistant. Then if you're a medical doctor, $200,000 to $300,000. The highest one doctor told me he's got $300,000 in student loans. Even if you go to nursing school, that's become expensive. But this concept of autonomy, so much of it is controlled by bureaucracy now. I wanted to read this article, or just review this article, called, I found that I'm here in the doctor's lounge. PAs get to share the doctor's lounge. There's only 3 of us, so they don't feel threatened, and hardly anybody ever comes to the doctor's lounge anyway. We kind of pass through it. This article was written by Dr. Sunil Dand, and it's a review of an article called "The Demise of the Physician's Lounge: A Sign of the Times," and it looks like it was written by I think it's from a website, or a vlog by Kevin MD. I'll put the link in the description. But it says, what does it say? Oh, sadly for the physicians, this job perk, talking about the doctor's lounge, has fallen by the wayside. Where lounges still exist, they are ghosts of a room, places of minimal interaction, increasingly occupied by doctors glued to their computer screens, fiercely typing and clicking away to complete their tick boxes before going to home. Treats such as cable television or sofa have long since disappeared. Uh, we, we have we have sofas here and cable television, so our lounge is pretty nice. But like I said, it's not too many people actually stay in it for more than a few minutes. But one of the interesting parts of this article review said that, as the original article suggests, there are a number of reasons why this has happened. This being the disappearance of the doctor's lounge, but it all essentially boils down to the monumental loss of independence and autonomy of physicians, as they've switched to a controlled employee-type corporate system in an environment of increased bureaucracy and workload. It also represents a sea change in how, I think, a sea of change in how hospital administrations view and treat their physicians. So I think that kind of echoes what I've been saying, and what a lot of doctors have told me, that there's a loss of autonomy, and I think a loss of respect also. Somebody on one of my videos, somebody in the comments section asked me, do I get a lot of do I have a lot of prestige, and do I have a big expensive house and a big expensive car as a PA? Because that was one of their concerns. It was like, well, do you get the same respect and money as the doctor? It's like, no. I mean, if I introduce myself as Omar Abdul Malik, medical doctor, versus Omar Abdul Malik, physician assistant, the connotations are different. Yeah, I'm not going to get the same, like, ooh, ah. But unfortunately, that ooh and ah kind of thing comes from what people associate with medical doctors. So there's lots of money. You go onto any website and say, well, what's the average salary for a doctor? Like, I think a family doctor and a pediatrician are on the lowest range in terms of income. They make, like, I think 160 to 180, if I'm not mistaken. It depends on what website you go to. But with the highest being like orthopedic surgery or plastic surgery making, or interventional radiology, I think they make close to 400 or 500. Which, if that's what you want to do, if it's the money that you're looking for, you can do things like for-profit hospital administration and pharmaceutical CEO. You'll be making millions. But in terms of loss of prestige and loss of autonomy, this is things that a lot of doctors are dealing with, and I think it's one of the things that it's one of the reasons why we've seen a decrease in people applying to medical school, and then even the people that apply to med school, they're not going into the mostly needed specialties like internal medicine. I was talking to a doctor who was doing some procedures. I said, "Wow, are you intensivist?" He says, "No, I'm just an internist, quote unquote. No, I'm just an internist." So it's like there's even hierarchy in among medical doctors. So if you're looking for a lot of prestige and a lot of 100% autonomy in becoming a doctor, know that it might not necessarily be there by the time you finish. It's a long road. Some of you all that have contacted me from the comments section, you're in high school now, or some of you all are about to go to college. Understand, you got 4 years of a 4-year undergraduate degree. Then you got to take the MCATs. I would suggest really studying for the MCATs. I did this. It worked. It greatly improved MCAT scores. That may take you months. You got 4 years of medical school. So that's 8 years just of school. then if you're just an internist, like one of my colleagues was saying, that's a 3-year internship, or a 3-year residency rather. So that's what? That's 11 years of training in schooling, and then to go out and be a worker at a hospital. On the same, you're slightly higher on the hierarchy because you're a medical doctor, but you're still a worker. You know, nose to the grindstone, as they say. Back in the rat race. So you gotta really think of why you want to be a doctor, because this is going to be one of the questions that you're going to be asked if you get to the point of your medical school interview. Why do you want to be a doctor? Yeah. Uh, if you give the trite answer that everybody gives, well, because I want to help people. I'm going to say, well, you could help people by being a nurse or a physician assistant or a scientist. You'll be like I did on my medical school interview. I was like, uh, uh, oh yeah, that's right. And I was embarrassed because I hadn't thought that question through. And had I spoken to more doctors, I think I would have been better educated about the future of medicine. And I'm glad to be a physician assistant now, but I I think the future for physicians, I hope that it gets better for them. I hope that they're able to get back to the autonomy that they once had. Uh, I hope that physicians that choose primary care and choose to work in resource limited areas like the inner city where I work and out in the rural areas, I hope that they get the autonomy and respect that they deserve. But for those of you all that are planning on pursuing a medical degree, understand that there's been a huge paradigm shift in in um, in medicine, and it's become very challenging for a lot of doctors. I don't say this to discourage you, but I do say this to let you know what you need to be prepared for. Guys like Antonio Webb and Dr. Andre Pinacet, they can articulate about this on a much higher level than I can. They're doctors. They're doing their surgery. I think both of them are in surgical residencies now. But it's something to think about as you're trying to make your decision between, if you're going to do nurse practitioner or medical school or physician assistant. I think all three are good. All three professions are good, but also just understand that if you pursue that medical degree, understand that the paradigm shift isn't the paradigm shift means that doctors aren't aren't getting quite the perks that they used to get. But I've rambled on all long enough. It's the end of my shift. God willing, I'm going home. I got to come back here tomorrow. Okay, please subscribe to my channel. Please check out Adana the PA. Check out her YouTube channel. She's a mother and a wife of two beautiful young girls. She's gone through PA school. It's pretty awesome. Check out Antonio. Oh, I'm sorry, Kanan Brown's YouTube channel. He's finishing up his nursing degree, and there's a guy named Kim who's a physician assistant student. So I'll try to put their links in the description. But I'll see you all later in virtual YouTube land. If you have any questions or comments, please put them in the comment section. Peace.